Good afternoon. First of all, I would to thank you for the kind invitation to be here with you and to participate in this event. And I try to share with you, let me say, some key elements that, in my opinion, will define the future health data spaces. And let me confess one issue. I'm a lawyer. And that's really important because in some events like that, I'm the most hateful person in the place, but it will not be the case. Let me say that the fact is that usually it's often considered to be a difficult goal to achieve the building of a data space when you are facing data protection rules and other legal issues. But in my opinion, my aim here and today is to tell you that everything is possible and things happen. But we need to work really hard. And to work in this area, we need to collaborate from the beginning, considering developers, researchers, business units, business model, and lawyers. But from the beginning, from the requirements phase of any development. Let me say that during my speech, I tried to talk about the conditions of the European Health Data Space regulation that is expected on January, to share with you different data spaces configuration alternatives, and to identify some risks related with health data spaces from a legal point of view. First of all, probably here the main point is the future Article 50 of the European Health Data Space regulation. That regulates what they said, secure processing environments. This is a precondition of a data space, but this will be a precondition of the data processing environment of a trusted data holder. In this environment, you could play as data space, and then you are providing services for processing data. Or you could be a data holder, let me say a hospital, who has a secure processing environment in order to collaborate with the environment in a federating processing services, or directly giving access with a data permit for a data access applicant. But in order to be a trusted data holder, you need to have a secure processing environment, high performance capacities, quality and utility of your data sets, and in addition, be capable to apply the full regulation and collaborate with the health data access body in order to implement the procedures for giving a data access permit. As you see in my slide, all of these measures are really well known. We are talking about restricts access to secure processing environment. We are talking about minimize the risk of the unauthorized reading, copying, modification, and so on. We are talking about, let me summarize. We're talking about authentication, prevent intrusions and unauthorized use, clear definition of profiles and permissions granted to the user with a clear distinction between user and administrator profiles, traceability, and periodic checks and audit. But this is the general list of secure measures adopted in everywhere. No news here. No relevant news. But let me say that I will underline afterwards the idea of traceability and control over users and software intermediation. On the other hand, the law states in the paragraph 4th that the Commission will public any kind of standards by an implementing act. Then we have to deal with these general requirements and a future implementing act of the European Commission. And I'm really curious in order to understand what the contents of this implementation act will be. First of all, because it's obvious that they can include in the general regulation all of the possible measures to be implemented. But how they will play with national standards? Because in my case, in Spain, if you are a health public entity or you are working for health public entities, you need to apply a national standard framework on security. Or how they will relate the Implementation Act with really well-known standards like ISO 27001 family of standardization rules or standards. On the other hand, let me say that there is a main principle here is that healthcare data, electronic healthcare data, will process it in Europe. They can't be transferred outside Europe without the due procedure. And we have to expect the implementing acts of the European Commission on that. It means that the first rule is for processing data, healthcare data, for secondary uses in European Union countries. But we have to understand what will be the rules for external providers. They will admit, for example, ISO 27018 in cloud services. On the other hand, the Commission should define the conditions for a secure processing environment in different secure data spaces. For example, they have to consider their own infrastructure, health data. Health data EU will be a common infrastructure for trans-European data processing, maintained and controlled by the European Commission. On the other hand, there will be national data spaces. I expect this is the case of Spain. Our Ministry of Digital Transformation is developing a national health data space. Now, I'm working in a future authorized participant, we expect that. I'm in the project EUCAIM, Cancer Image EU, that will promote an EDIC, European Digital Infrastructure, address to processing image of cancer and related healthcare data for promoting research, secondary uses, and developing AI. Then we are waiting our role and the conditions of design of the data space. And finally, trusted data holders. At the end of the day, we will consider different possible configuration. This infographics, is in a document for the Spanish Data Protection Agency about the adequation of data space to GDPR. This is in Spanish and in English. Then, in any case, I will provide you the document that is really interesting. And there is an additional document of INISA regarding data spaces. This is one. In this case, we are talking about a hospital who is developing conditions for processing open to data spaces. Let me say that in our project, in EUCAIM, we have considered the level of maturity of this data holder. Then we need that it will have a secure processing environment, it will have availability in terms of data processing, it will have interoperability, and so on, in order to process data. There are other different spaces. Let me say that we will play in a trans-European project with our data space, such as EUCAIM, data altruism organizations. It could be that in future there will be any kind of aggregations, such as a marketplace. And in any case, all of these spaces at European or national level must be provided with an appropriate governance framework. It affects not only the definition or the development of the space in terms of security and conditions for processing, but in terms of staff, procedures, and ways to manage data. Let me give you different examples of this kind of data space, could be a possible consideration. I will show you an image of EUCAIM that combines a central node with a federated data processing, and in future, let me show you it again. This is one. This is other, where you could mediate between users and data holders. This is a case of federated processing. Or we expect that in the European Union environment, different data spaces will be communicated. Because, let me say, we are thinking in European health data space on healthcare data, but there are so many data related with a patient situation, like mobility, socioeconomic data, chemical information, and so on. That means that in future, you have to connect different data spaces in order to infer relevant information. You can make any research on cancer due to a contamination in the workplace, in the working place, without combining different information, and not only those that comes from the healthcare services. And this is EUCAIM. In EUCAIM, we have, let me say, this circle. It shows you the idea if this is a controlled and closed environment where a data user could register and access to information about our dashboard of applications, catalog of data sets, and could ask our data access committee in order to access to data for processing. In that case, they could process data locally, here or here, in a federated data processing, but if the data holders are not capable for giving us certainty about the capability of the resources for processing data, we could put data in our central node in order to provide processing. There are so many additional risks in terms of the building or developing of a health data space. This is not only about technology, but about legal issue. First of all, let me say that in terms of security processing environment, you have to achieve certain goals. The first one refers to the software itself. Second, refers conditions for federated processing, and a combination of both regarding the processing of anonymized data. I will refer to anonymized data at the end of my presentation. But we assume, or the law assumes, that in this secure processing environment, you will be capable for sharing data with the help of the software intermediation. At the end of the day, let me say, what we are trying to build is a secure environment where the data user could make a query, could ask different data sets all over Europe without any capability of copy, downloading, or extraction of information in order to protect in origin the data. Okay, this is extremely relevant from the point of view of availability. Because in my knowledge as a jurist, but in literature, when you are talking about that, you read about differential privacy, you read about multi-party computation, homomorphic encryption, you read about different technologies that are extremely demandant on capabilities of processing. And I'm really concerned with that because in some cases, data processing on health research, on secondary uses of healthcare data, will be similar to neural networks. I imagine a scientist who make a query on Friday afternoon, because let me say, it's really convenient to gain the outputs on Monday morning. Then are you sure that all of your nodes will process data properly and give you the outputs? How many nodes could fail during the weekend? Let me say, I know really the case of Spain. To consider the possibility that in a hospital, in a public environment, there will be people working on premises on Saturday afternoon is really impossible. Then what will be the case? Because at the end of the day, on Monday, if 3 nodes failed, what about explainability? What about bias? Then here, availability is absolutely essential. If you are playing here, you need to grant that. Why is it? Because now I think that in our countries, we will know probably so many hospitals that are implementing AI tools and, let me say, different machine learning activities, but usually they are working with 1, 2, 3 simultaneous projects. But we are talking about Europe. We are talking about processing. If your data set is really well and is really well known, then you will be working with so many concurrent queries. 5, 10, 15, I don't know how. Then you have to be capable to be available, because if not, you are in a hurry. On the other hand, you have to identify the player's requirements. Okay, you are a data holder, and you are sharing with me a data set on healthcare data. But do you need an ethical approval in your country? Could you give me evidence about that you have fulfilled GDPR? Third, have you provided reliable anonymization, or do you need my services? Let me say, as OCAM infrastructure, I could help to anonymize. The future health data access bodies has the mandate to promote and to help data holders to anonymize data. Then it must be clear, are your data sets properly cataloged? Are they really providing quality and utility? And what about patients and consent? Now we are playing in Europe with consent rules, and every patient could withdraw the consent. But this will not be the case in European health data space. If you are processing anonymized or pseudonymized data, you will be capable for processing it without patient consent. But we give patients the opportunity to make an opting out. This is not a legal issue, but for European health data space, reputation is really relevant. Because if you suffer a national campaign on opting out, you have no data. Because for patients, it's so simple. Please, I make my opting out and I don't want to participate in European health data space secondary purposes. And there are only exemptions for public bodies in cases like pandemics, not for the other operators. Let me say that data access applicant must also provide safeguards. At the end of the day, they must fulfill the law. They have to apply for a data access permit fulfilling the conditions of the European health data space. In addition, ethical conditions, security conditions, they must accept the rules of the environment, especially in terms of security obligations and non-identification commitments. But at the end of the day, let me share with you, this is not in the slide, a lesson learned in a digital innovation hub. I don't know why, but European Union assumes that people is fulfilling GDPR and people is familiar to GDPR. And this is not true. And in the European health data space environment, there will be new players. Because if you see the secondary uses on Article 34, there are an openness to innovation. there are an openness to entrepreneurship, there are an openness to develop AI tools. It means startups. It means new business, new companies, new research initiatives, and new players. They are not only physicians. It could be engineers, people from economics. Then it means that they are not familiar with requirements for processing data. In my opinion, we need to help from data spaces to these players to understand and to know what is required for processing data. And this is not only because they assume a responsibility processing data, but due to the fact that in many AI developments, you are not only processing data sets from the repository, you are adding your own data sets. And if you are adding your own data sets, you have to fulfill the law properly. Finally, I need to, let me say, underline that me as data protection officer is a relevant person here. But at the end of the day, you need to have a team that has experts in ethics, data protection, secure developing, data analytics. Here the team, the staff, is really relevant in order to support the operational activities of a data space. More and final risks, anonymization. Let me know, I usually joke, but I'm here in danger because usually I make a joke saying that if you are German, anonymization is impossible. But because this is my experience when I talk with a data protection officer from this country, that they are not confident on anonymization techniques. And that's a problem. Why this is a problem? Because for the data protection authorities, a proper anonymization means an irreversible anonymization. But there are two additional standards. You have to consider the capabilities of any person in the world. And thirdly, you have to consider the future technology. Then it's stupid because, okay, then if I think that in 5 years we could have quantum computation, no worry, anonymization is impossible. If I consider third parties here, anonymization is impossible. But what I show to you here is a closed environment. No third parties are here. No quantum computation is used here. And in our design, we're applying this methodology. We're applying 2 layers of anonymization. We are making a risk analysis in order to come back or go ahead. And we are designing a trustable environment in order to control any activity of the user. Then, in my opinion, and let me say in the opinion of the industry, pharma industry of Germany that has published a book on that, we could talk about de facto anonymization, a way of anonymize where the data user can re-identify in any case. And let me say, this is the approach of the General Court of the European Union. We are waiting the Court of Justice final decision on that. And finally, there is a problem with Data Governance Act, the interactions between Data Governance Act and data altruism between European health data space. Why? Because data altruism is based on consent. And the European Data Protection Authorities in 2020 said in a guidance that a wide consent is not possible in GDPR. It means that you have to provide a specific consent, activity by activity, research project by research project. Let me share with you the Spanish regulation. In Spain, you could consent for processing data in healthcare research based on areas of research. It means that I could consent in Spain to give the opportunity for processing my data in the area of lung cancer. And in that case, in Spain, you could legally process data for lung cancer projects. But this is not the case at the European level. You have to consent for the project A, B, C, D, E. Under Data Act, you will develop what is called consent wallet. Then at the end of the day, you could consent with your mobile phone. But you have to design it. The consent is an informed consent. It means that when I say, okay, I want to consent, it is not saying, okay, oh no, there will be an anti-scrolling tool in order to be sure that I'm reading all of the information. It needs time to do. And at the end of the day, first day, I will consent once. The second week, I'm pretty sure that I will consent 3. But if in 3 months I will be asked for consenting 50 times, I will say, no. If I'm not a patient, I'm suffering click fatigue, and I'm not in this position to dedicate all my life to read your information and to consent for processing data. Then probably we need to change approach about how to give consent for processing data. Because now this has been designed by lawyers who are not aware about how reality is. And that's all from my side. Thanks.
Thank you. Any questions?
No. In your country only in 1996, but they derogate the disposition of going to jail infringing GDPR.
My question would be, are we maybe in Europe look too much on security? Because the example of quantum computing is that we then don't have anonymization, but the thing is, if we get quantum computing, then anonymization of data is the lowest problem we have in the whole world, because every cryptography is then doomed, and then we have different problems than think about what happens with our medical data. It happens when we got quantum computing. So maybe we make ourselves problems where are no problems, because as Boris Otto mentioned in the first, in his speech, we have to find a balance between sharing data and not sharing data. Maybe find also a balance about security and not security. So we get like a working concept which is not completely secure but enough secure.
I mean, in my opinion, this is, in practice, is not a legal issue, but a technical issue. At the end of the day, I think that it's brilliant to promote secure processing environment, because in a control environment, you could take decisions on what kind of software to use inside, and you have controls in all of the sites, because, okay, if a data holder wants to participate in a data processing environment, they need to give us guarantees. If a data access applicant asks for a data permission, we have controlled this applicant, and on the other hand, all of the activities are implemented inside the system. And I think that is enough in terms of control about the whole system. But let me say that I'm not confident in how we deal with that, because we have to promote secure culture of organizations. Because if we are betting on federated data processing, it means that at national level, at local level, at hospital level, security and the design and developing of secure systems, it's an investment. And they must be conscious about that. Then what my main concern is that if we are, like in past, making rules without consider the previous investment and design of infrastructures. I'm concerned about that, because law probably is good, but if in reality I have no secure processing environment, I have no trustworthy on data holders, I'm in a hurry.
You
said it is not possible and not practical to give my consent to each project. And are there maybe approaches to take a survey with the patient and based on its risk level, he would be categorized in a group, and based on this, yes, the legal agreements would be divided from this, or is this too broader?
Yeah, let me say that I'm researching on that, and we compromised in OKM project to make an experiment on data altruism. And probably we will play with two different strategies in order to have measures about one and the other. In the case, one will be the traditional way to conceive express consent or active consent in GDPR. The other will be a consent based on a first granularity consent. Let me say, it will not be a consent about, okay, do you want to share your data in lung cancer research? This will not be the case. We will ask the patient about, okay, the patient or a person, in what area? Do you forbid any additional use? Okay, I'm not in this position to consent for processing data for commercial purposes, okay. Then, our strategy will be to provide this granularity consent, but with regular transparency on data use. This is not only about, okay, you are consenting previously about the use of your data in a context defined by you, but you regularly will receive information about the specific projects where your data have been used, and regular information about your right to withdraw your consent. This will be the second experiment in order to understand if this is secure, this is understandable for persons, and this is useful. But I have no responses now. We have to research on it.
Thank you very much, Professor. So, no more questions? So, thank you.